Hi, I'm Dr. Melissa Leedy, clinical psychologist at Legacy Counseling Service in Broken Arrow, Oklahoma. Today I want to talk to you a little bit about worry. So everybody worries, and most of the time we try to squash our worry or distract ourselves or pretend like we're not worrying. But really, when we're worrying, that's kind of an indicator to us that we have something that's important, and this thing keeps running around in our mind because it's important to us. So really, when you worry, that should be an indication for you that you really want to prioritize that. You really want to spend some time really thinking about why am I worried about this? What do I need to do about this? Or is there anything that I can do about this? So I really encourage people to actually spend some time and create some specific worry time, usually in the early evening or sometimes in the early morning when you wake up, and really go over those things that you're concerned about. Give them a high priority, because if they weren't important to you, you wouldn't be worried about them. So there's one technique that I like to use with people. It's very, very helpful, because it helps move the worry out of your mind and onto paper. It allows you to go back and look at some of those things that you're concerned about, and also allows you some freedom to really brainstorm, okay, how can I really address this concern? Because my efforts at just squashing it or pretending like I'm not worried or trying to distract myself are not working. So this is called the Constructive Worry technique, and basically what you want to do is just get a piece of paper and draw a line right down the middle of it, and on one side you want to write down what the concern is. Okay, so this can be a concern that you can do something about, or it might be a concern that you're really not able to do something about, or something that hasn't even happened yet. So on the other side, you want to write what are some steps towards resolution of this worry. Now, it doesn't mean that you're always going to be able to control everything, but knowing that you're influencing things as much as you can sometimes helps reduce worry. So in this example, somebody is worried about getting cancer, right? So there's some steps that they can take that will reduce that worry. It doesn't mean that concern is fully going to go away, right? Because this is an important concern. Might represent a lot of different things to this person. But there are some steps that they can do that will help them feel more in control of their worry and of the situation. So when you have specific worry time, so maybe they say, okay, well, what's one thing that I can do to towards resolving my concern that I might get cancer? Well, one thing is that they can keep track of concerning symptoms. So if it's a skin cancer, worry, then you might want to be taking monthly pictures of the area on your skin that you're worried about. Or you might want to just keep track of how often you do breast exams and if there's any changes in the breast tissue. So that would be one thing that this person could do towards resolving their worry. Another thing would be to keep or schedule regular doctor's appointments. Just so that you have your 6-month or your annual exam, but knowing that someone who has training to look at those symptoms, that they are looking at it, and sometimes that can help reduce your worry. A third step towards resolution is to keep good health habits. So we know that eating well, decreasing carbonated drinks, exercise, reducing stress through prayer or mindfulness, all those things are really important for your health. And as your health, is improved, that will reduce your chances of getting cancer. So that would be another thing you could do. And then the fourth thing would be to practice mindfulness or prayer or some other kind of stress reduction technique. But again, these steps aren't like foolproof where you're going to automatically not be worried about this anymore. But the point of having scheduled worry time, the point of using a constructive worry sheet, something like this, the point of using scheduled worry time or using constructive worry techniques like this is not to totally get rid of the worry, but to prioritize the importance of the thing that you're worrying about and just help to reduce the worry so it's not so overwhelming in your life. So I hope this little tip helps. Try it out for a couple weeks or a month or two and see if it helps. If you have any questions or if you want to talk to me about the type of therapy that I do with adults, you're welcome to check me out on my website at www.legacycounselingservice.com. So I hope you have a great day, and look for future videos, and I'll be giving you more tips about how to help with your mental health. Thanks so much. Bye-bye.